some transfusions. Did you receive some transfusions? Were different tests done on you? Somebody has taken, done the ascitic tap, somebody has taken fluid from your pleural cavity? You are supposed to ask this question. So this is the history of hospital stay. The complaints with which patient landed. Have those improved, deteriorated, or still the same? Did patient develop new complaints during the hospital stay? Some interventions were done during the hospital stay or not? So these are the things which must be asked whenever you are seeking details related to the complaints of the patient. These are the 4 paragraphs. Now the time comes that examiner asks you to elaborate these things. When you are going to give details, when you are going to present your case in exam, you won't start like that. But you would always start with first sentence as, if somebody is having some problem ongoing from last many years, like a person is say diabetic from last 20 years, presenting complaint is weakness of one of our body from last 5 days. Say a person is having weakness of one of our body from last 5 days, but he is a known diabetic from last 20 years. So how I would be presenting this case? My first line gonna be, sir, my patient is a known diabetic from last 20 years. He is on oral glucose lowering agents from that time till now with good compliance and poor control. With poor compliance and poor control, and now presented with weakness of one of our body. Say a patient is having ischemic heart disease from last 10 years, now presented with swelling of feet from last 10 days. I would start my sentence like, sir, my patient is a known case of ischemic heart disease from last 10 years. He is taking therapy, treatment for his symptoms of ischemic heart disease from that time till now with very poor compliance and bad control, and now presented with swelling of feet from last 10 days. You just immediately, you are supposed to immediately complete that sentence. You are not supposed to start discussing about the details of diabetes. Your focus should be on presenting complaint. But that first sentence was important. Why? Because the presenting complaint was connected some way with that long history. If the presenting complaint is not connected with long history, then you are not supposed to tell me about that particular thing. My patient is having itching over the tip of nose and back of ear from last 20 years. And sir, he is presented with weakness of one of body from last 10 days. Well, it's quite strange, gentlemen. So what do you think is the association between these two things? No association, sir. Then why did you try to mention that thing right at the start of the history? Well, that just came to my mind, sir. So that's the only reply you can give. So what I wanted to highlight here, that if an ongoing problem, a long problem is connected with the presenting complaints, then you will speak about that complaint, but not going in details. That's another important point. And even here you would use the word, sir, my patient was in usual state of health 10 days back. Why usual state? Because there was an ongoing problem coming from last many years. Try to understand these two things, all right and usual state. Where you would speak the word all right? If your patient is not having any major issue or problem ongoing in continuum from last many years, even if somebody can have say tuberculosis at the age of 6 years, now he is presented at the age of 20 years with that right hypocordial pain, jaundice, discoloration of eyes. He had tuberculosis at the age of 6 years. That remained for 9 months. He took complete course of ATT. He got better. What word I would use here? Sir, my patient was all right 2 months back as he developed that complaint of right hypochondria. Here I would not use the word my patient was in usual state of health. Why? Because there is a past event that happened, that settled down. But if he would have been having some problem ongoing from that time till now, then I would have spoken the word, sir, my patient was in usual state of health otherwise 2 months back when he developed that complaint. Got it? So you should be clear about these two things, where you are supposed to use this word all right and where you are supposed to use this word usual state of health. And again highlighting on that aspect where many students start describing that disease which was there from last many years, start to elaborate it in history of presenting illness. That's not the way. Like what you will be doing. One of the students will come up with an answer. Well, sir, 30 years back, on a beautiful morning of December 1991, it was 23rd of December, my patient was walking in the garden and he felt an urge and desire to pass urine. Obviously, as he had that urge to pass urine, he passed urine, came back, started walking again. After 10 minutes, he had again that urge and desire. He said, why this is happening to me? That didn't happen earlier. And with that thought, he again just passed urine, came back, started walking again. After 10 to 20 minutes, third time he again felt that urge. Then he recalled it's December, it's quite cold outside, probably this is the reason. As he passed that urine third time, he had something else in his mind, that this is something strange happening with me. He went to see the doctor. Doctor said, well, this is something strange. I want to get your few of tests done. What is happening here? I'm not interested how he was diagnosed as diabetic. I'm not interested in the details of every day from that beautiful morning of December 1991. I'm just interested to know one thing, that he was diagnosed as diabetic from last 29 years. That's what I'm interested in. So don't just go in those details. These details are needed in past history. So that's all about history of presenting illness, its paragraphs, how you elaborate things, and in next 5 to 10 minutes we'll finish with the rest of the history. And that's first one, past history. Then the next would be family history. Third would be personal history. Fourth would be socioeconomic history. Fifth would be drug history or vaccination history. In female, gynecological and obstetric history will add. Past history. Remember a few things always. Whenever you are giving details about the past history, always mention, never forget to mention few important things. Like you are always supposed to mention the previous hospital admission. They are important. This is worth mentioning. History of previous operation and hospitalization, always mention. And then depending on situation, the situations can vary from person to person, but most of the time in adult medicine, the history of ischemic heart disease, diabetes, hypertension, asthma, tuberculosis, jaundice, we are living in Pakistan. In these areas, in our belt, these problems like tuberculosis infections are quite prevalent as well. So we are supposed to mention questions related to these complaints. Ischemic heart disease, tuberculosis, hypertension, diabetes, these things are obviously elsewhere in the developed world, everywhere as well, but few things are important in your circumstances, considering your epidemiology. Step next, past history, personal history. Personal history, my patient is, say, you just are supposed to say, sir, my patient is neither a smoker nor addict, his sleep and appetite is normal enough. No major other things you are supposed to mention in that personal history. Drug history, always highlight and always mention, sir, my patient is not having any history of prolonged drug intake for any recent or past problem. That's the first sentence you are going to speak. My patient is not having any history of prolonged drug intake for any recent or past problem. Patient is not having any history of drug allergy. There is no history of Hakim medication, steroids, kushta intake. In our settings, these things are important. Kushtas are heavy metals, and a lot of patients take these heavy metals so that they would be having a lot of power and ultimately land with hepatic failure and kidney failure. So Hakim medication, kushta intake, steroids, how you gonna ask about steroids? You would be asking the patient कि आप कोई एक खरबूजे के बीज की तरह की गोली वो तो नहीं इस्तेमाल करें. So that's how you seek details related to that aspect. Drug history में these are the things which are important as far as drug history is concerned. socio-economic history. Ask patient about all the details. Ask patient how much he can earn in a month, having his own home, his own car, about all those things. Many a time our socio-economic history is based on impressions. Don't do these things. हर धोती वाला गरीब नहीं होता. हो सकता है वो लैंड क्रूजर से उतरा हो, आपके पास मोटरसाइकिल हो. So please ask him about how much he earned and all these things, right? Then occupational history can be taken, and similarly family history, the diseases which run in the family. You should know about those diseases: diabetes, hypertension, ischemic heart disease. So the diseases which run in family, you are supposed to ask details about those aspects as well. And then obviously in gynecological history and obstetric history in females. And remember few important other things as well, that as I mentioned earlier, that your past history will change accordingly. Like if I am having a suspicion, I am having among my list of differentials that a person is having chronic liver disease. This is one of my differential. Then in past history, what questions will be added? I would be asking that patient, have you had previous history of blood transfusions? You do shave yourself, or you go to barber? Have you received lot of injectables and drips in past? That changes. You are having a patient where you are having a suspicion of rheumatic heart disease. What I'll be doing here? I'll be asking about in your childhood. Say that patient came to me at the age of 25 years age, and I would be asking from his grandmother, his mother, his father besides him, do you guys know, or can you guys recall that during his early childhood he had problem with his joints? He had pain in his joints which was migratory in nature, coming from one joint to another joint. So I was interested to know about the episode of rheumatic fever then, which ultimately lead to rheumatic heart disease now. Fine, you understand, right? In different situations, you can add few questions in the past history. And finally, the last thing, which I forgot probably to highlight earlier, that when you are taking details of presenting complaint and you are asking about the associated features, it's not simply the associated feature about which we ask, but we ask question that way. Like a patient says a case of rheumatic heart disease or rheumatic fever, so I would be asking question, do you have any preceding history of sore throat 3 weeks prior to that episode of that joint pain? What I am doing here, I am asking from patient that are you having symptoms of chest discomfort, heaviness or pain? Are you having swelling of feet beside your symptom of joint pain? But I am also adding a sentence here. Do you have preceding history of sore throat 3 weeks prior to it? I will be fully justified while asking details of presenting complaint in those situations where a preceding symptom can result in the manifestation patient was having. So I would be repeatedly using the word, two words. Do you have any coexistent or concomitant history of this and that? Do you have any preceding history of this and that? Do you have any coexistent problem like this? Do you have any preceding? So again and again, when I'll be asking question while describing the presenting complaint and associated feature, I would be repeatedly using these words: coexistent problem, this and that, preceding complaint, this and that, depending on the situation. This is the way how you are supposed to take histories from your patients. Thank you very much.